And good afternoon. Welcome to our Lunch and Learn. And today we're going to be talking about creepy crawlies, right? We're going to be talking about parasites and how most likely, if you have any kind of health condition, it can be parasitic and people need to look for parasites. And we do, all right? People will say, well, how do I get these? Well, you can get them by walking around outside barefoot. You can get them from swimming in the lake. You can get them from swimming in the ocean. You can get them from your animals. You can get them from eating contaminated food. So it's easy to get them. And so we're going to be talking about this because a lot of times this is at the root of any kind of health condition. So it's hard to imagine that here, when we have very clean water and very clean sanitation and that kind of thing, that we could be harboring parasites. However, there was a program on PBS a few years back, and it was called The Monsters Within, and it talked about parasitic infection in human beings. And so I have done a lot of study. I have done parasitology classes because parasites are something that we deal with. A virus is a parasite. Bacteria are parasite. Most of the time when people think about parasites, they think of tapeworms and that kind of thing. And yes, those do exist. And yes, they exist here in the United States. There used to be a craze, I think in the early 80s, that might not be quite right, but you would send off for this specific magic pill that would help you lose weight. And inside this specific magic pill that you would ingest would be a tapeworm larva. And so you would ingest it, it would go into your system, it would grow, and it would take all your nutrition. And yes, you would lose weight, but you would be infested with a tapeworm. And that just makes me want to cringe. When we used to live in Scotland, we decided to take a road trip. We had a, I can't remember the name of the brand, but it's the Dulux paint dog, if you remember what they are. Old English sheepdog is what it was. And we took her with us, and she got car sick, and she just barfed all over the back seat. And guess what was there? Huge tapeworms. So I've had experience with them. People that we have looked at here in the clinic have had experience with them, and we don't want you to have a parasite infestation and not do anything about it. Okay, so we're going to talk about what it might look like and what the statistics are. And this is just amazing. Okay, amazing in a good way. We want to get rid of these. And part of our daily, our annual cleanse that we do here in the clinic and that we recommend certainly for anybody over 50 does have parasite herbs in there. So you should be, we treat our animals, we worm our cats and our dogs and our horses and all that. And we should be worming ourselves and our children because we are just as susceptible as they are. So the parasites eat our blood, our tissue, and our food. And we can have parasites for years and years and years. They range greatly in size. Some of them are microscopic. Some of them are very large. We have had people, I have never seen this myself, but we have had people send me photos of worms that they have expelled from their body. And so we know that it does happen right now in this day and age. So worms and flukes may be swimming around you right now, and you would not know, and there may not be any signs or symptoms or a positive stool test. So a lot of times people will say, well, I had a stool test and it didn't show anything. Well, we're going to tell you why that is. Ancient people knew about parasites, and they would worm their children, they would worm themselves every day. Old medical texts contain numerous prescriptions and protocols for ridding the body of various types of internal worm infestations. They enter the body by various means. Mosquito bites, right? How many of us have had mosquito bites? Me, lots of them, all right? Contaminated food or water, inhalation of contaminated particles. You don't know when you're breathing if there's contaminated particles in the air unless you're in a dust storm, and then of course you know there could be things that are contaminated in the air every day, all the time. And then, of course, your animals. One of the most prolific progenitor of parasites is the cat. Women who are pregnant are asked not to mess with cat boxes, not to clean the cat boxes, because cat boxes have, or cat feces has parasites, and we're going to talk about that. So let's just talk about some of the parasites and some of the diseases. So there's malaria. Malaria you get from a mosquito bite that bites an infected person and then bites another person. I bet you thought malaria was something else and not a parasitic infection. Toxoplasmosis, which is you get that from consuming undercooked or contaminated meat and water, also by handling cat feces. We talked about that. Trichomonas, which is from sexual contact with an infected partner. Hookworm disease, that is larva that is contained in the soil. It penetrates the skin when you walk around barefooted. Now, there is grounding and all that kind of stuff. We want to do grounding. We believe in grounding. Just be careful where you ground, all right? You don't want to walk around and ground where the soil is contaminated. Ascariasis, which you get from infected soil or food or water contaminated with the eggs. Now, this is your roundworm infestation, and it's very, very prevalent. Lice is a parasite. You get that from close contact with an infected person, sharing hats, sharing different things like that, personal items, so you can get lice. The bubonic plague, of course, your fleas bit the rodents. The rodents then, were in the human space. The fleas were in the human space. People got it, all right? Lyme disease, that's when a tick attaches to you and it sucks your blood, and while it is taking out the blood, it is injecting this other stuff, which gives us Lyme disease. Scabies, you get scabies from a direct contact with an infected person or contaminated bedding and clothing. I know someone that had a case of scabies. She bought something from a store, came home, put it on her body, did not wash the item first, and the item was contaminated, and she had scabies from that. And you have to go to the doctor and get medicine for that because you can't see them. But if you've ever had scabies, it's very, very, very uncomfortable. Yes, I have had that. How did I get that? Well, I was a prayer partner at church and was holding someone's hand. I don't know who it was, but Monday after Sunday, I came home, or I woke up and I had all this rash all over me and went to the doctor, and sure enough, I had scabies. So it can be anywhere and everyone. It's opportunistic. It'll just attack anyone, okay? And then the last one is enterobiasis, which is ingesting pinworm eggs from contaminated hands, clothing, or bedding. So this is how we get them. All of us have been outside barefoot. All of us have swam in water that was not chlorinated. All of us have had insect bites. All of us have eaten out and have been, there's an opportunity to get these kind of things when we're eating. So we just need to be very careful where we go and what we eat. So today, in today's time, we are much less likely to attribute our symptoms to worms. We think we live in a country that doesn't have them, but I just want to tell you that that's just not so. All right. Anne Louise Gettleman, you may know her. She's very, very famous. She holds a doctorate in holistic nutrition, and she's been a nutritionist for over 30 years, believes that we need to pay much attention to parasites. This is a quote. She says, "It's far more prevalent in the United States than you would ever imagine. Studies indicate that 1 in 3 of us are infested with parasites." 1 in 3. So look around you in your circle, all right? If you have more than 3 people in there, then you may be the one, all right? And so we don't want you to be the one. So this is going to be very good information for you. Approximately 68 million people in the country are chronically infected with neglected parasite infections. This is here in the United States, according to the U.S. Centers of Disease Control and Prevention. 68 million people. That's a lot of people walking around with critters in their bodies. Although parasites predominantly affect tropical developing regions, as well as 2/3 of the population can be infected, internal parasites affect 3.5 billion people globally, according to a study in 2021. All right, that study was published by the Biomed Research International Journal. However, of that 305 billion people, only 450 million cases have symptoms. So you could have parasites and not even know, especially if you're not in tune with what your body is doing. Miss Gettleman wrote a book called Guess Who Came to Dinner in 1991, and it links parasites to common health problems. Hulda Clark, I don't know if you are familiar with her, but she is a Canadian scientist and holistic doctor, and she says that parasites, we lost power. Parasites are the main cause of viruses such as AIDS and also cancer. And so there are a lot of people that do believe that cancer is caused from parasites, fungus, all that kind of stuff. So we just need to be careful and keep our internal environment very, very clear. In 1974, Ms. Gittleman's professor displayed patient samples showing parasites from microscopic amoebas to foot-long tapeworms. She said it made her not want to eat out in restaurants for over 2 years. So it can really change your life when you start looking at what these things look like and how easy it is for you to be infected. This experience shaped her belief that parasites underlie most chronic health conditions. Parasites are overlooked by the healthcare practices when investigating the cause of symptoms. Parasites tend to be the last place they look, she says. Now, us here in the clinic, we look at that first. If you have been here, you know that we do testing and we do all that kind of thing, and we're looking for vibrational frequencies. Everything that is alive has its own unique vibrational frequency. Parasites have their own unique vibrational frequency. And so if you feel like you have parasites, we can test for that, and we can see if there's any kind of frequency that is, what's the right word to say? That is matching your particular vibration. So if there is, if you're testing and you are vibrating at that frequency, you probably have something going on the inside. Different parasites cause different symptoms. Some can lead to skin infections, some to organ damage. Certain blood-borne parasites, such as Plasmodium and hookworms, for example, can lead to anemia due to the loss or destruction of red blood cells. Now, hookworms are called hookworms because in their mouth, they've got little hooks, and when they bite into your intestine, that's usually where they are, they hook themselves on there and they just suck your blood. And so anytime that you've got anemia, we look for parasites. When you have acne, believe it or not, acne can be caused by parasites. So that's something that we see a lot in the clinic. And when we do the intestinal clean out and we get rid of all the things that are not supposed to be there, surprisingly, acne just clears up. And so that's something that we look at. We look for parasites. We've got right at 300 different types of parasites that we can see if you have an affinity for. And we can see if maybe you are carrying them in your body. And so we don't want that. And like I say, I do parasite herbs all the time. Why? Because I have a cat. If I have a cat, I'm going to be very, very exposed to the parasites because cats just carry them. All right. So don't get rid of your cat. Just make sure that you do parasite cleanses regularly. There's another parasite. It is a brain-eating parasite. It's an amoeba. It is known as Naegleria fowleri. Now, I may not have said that right. That's a new word. I have not seen that before. It causes serious neurological symptoms, including headaches, confusion, seizures, and even death. So this is something worth looking into if you know somebody that has seizures, if you know somebody who has headaches and confusion. We've had people come in who have had what they told me was like schizophrenia, paranoia, all that kind of thing. And when we tested them, we found that we believed that they were testing for heavy metal toxicity. So we did a protocol like that. The guy wasn't really believing what I said. And so he went to his medical doctor and he said he wanted a blood test for heavy metals. And sure enough, the heavy metals that he had a frequency for were exactly the heavy metals that came back with his blood screen. So for those of you out there that think that this is all hocus pocus and voodoo stuff, no, not so much. This is real science, and everything does have a vibration. You know how you meet somebody You might be at a restaurant, or you might walk into somebody at the grocery store or the department store or whatever, and you just kind of click and you hit it off. That's because you're functioning at the same frequency. You go into another place and there's somebody that comes in and it just like ruffles the back of your neck feathers. They don't vibrate at the same frequency that you do. And so it is offensive to you. It is something that you don't want to be around them because there's no affinity for those vibrations. So you need to remember and pay attention to how you are feeling around different foods, different people, different animals, all that kind of thing, because it's really important. Parasites often reside in the gut, so that's where symptoms are usually found, all right? Symptoms include diarrhea, abdominal pain, nausea, vomiting, and bloating. Parasites also compete with the host for nutrients, impairs the body's ability to properly use proteins, and hinder fat absorption, which all can lead to malnutrition. Now, here in the United States, here in my clinic, we have the PS3 scanner, which I did not put on my desk today to show you, but it tests you for how are you absorbing your fruits and vegetables. It measures the carotenoids in your skin. Most of the time, not all the time, but most of the time, people that come in who are experiencing health issues, they are not absorbing their food, and so they are malnourished, even though they might not be underweight. They might, in fact, be overweight, but they're not absorbing their nutrition like they need to, and so when you're not having the right nutrition, that makes you opportunistic for parasites. Other conditions are arthritis, hypoglycemia, obesity, autoimmune issues, and other issues that you would never ever think would have a parasite involved, okay? In many instances, the doctors who have recently tried treating the most recent virus using antiparasitic drugs, hydroxychloroquine or ivermectin, usually reserved for malaria. Malaria is what? It is a parasite infection, right? Have had anecdotal success. These drugs still remain controversial. They're okay for what they're prescribed for, but they're not okay for viruses. Now, I want to tell you, there's a doctor that I have met personally. I know him. His name is Dr. Simon Yu. He used to practice in St. Louis, Missouri. Not sure where he is right now. I haven't kept up with him in the last couple of years. However, he wrote a book called The Accidental Cure. It was all about using parasitic medicines, antiparasitic medicines, in people that had various diseases, and how when they used these antiparasitic drugs, all these diseases cleared up. He was a U.S. medical doctor who was on assignment in Bolivia, and their particular mission was to treat the Bolivians for parasite infections. He found, and he's a medical doctor, he found that whatever condition the people had before the treatment, as soon as they got the parasites taken care of, that previous condition was no longer there. So you can read all about his exploits in the book, The Accidental Cure, and we need to pay more attention to making sure that we are not ingesting and harboring parasites, or as I lovingly call them, critters, in the body, because they're going to take your nutrition and they're going to make you very uncomfortable. Researchers found that parasites may influence the course of viruses, especially the most recent virus. In a review published in June 2021 edition of the Journal of Clinical Medicine, highlights a similarity between the symptoms of parasitic disease and those of the most recent virus, and how the former may result in a misdiagnosis of the latter. So you may be going into the hospital with a parasitic infestation, and it's manifesting as a respiratory virus, so they're going to treat you for the virus instead of treating you for the parasite. So interesting story. When all this came out and I was doing all the research, I sent husband to Tractor Supply, and I said, I want you to go get some ivermectin, and we'll have it on hand just in case. Not afraid, not thinking we're going to need it, but just in case. So he goes to Tractor Supply, and he asks the guy for ivermectin. They took him back to where it is, and he did not purchase. He came home and he said, okay, I went to Tractor Supply. Are we a horse or are we a cow? And I looked at him and I said, what? He said, are we a horse or are we a cow? I said, why? He said, well, because ivermectin in a paste is for a horse and ivermectin in a syringe is for a cow. I said, oh, well, we're horses. And so, anyway, there was a whole lot of, if you remember back in 2020, early 2021, there were all kinds of PSAs. You are not a horse or a cow. Well, that's what that was about. Not that I made that famous, but people were looking at the research from alternative doctors, looking at the research that they were getting from different sources, and they knew that they could treat themselves with ivermectin. So you are a horse because you want the paste. That's what you want. This study with the virus supports Ms. Gittleman's suggestion that different symptoms may be linked to parasites without the healthcare providers realizing it. It may be that the body can resolve various conditions once the effects of the parasites have been removed. So an example of this comes from the case of Joe Tippin, who was diagnosed in 2017 with late-stage metastatic cancer. He was given just 3 months to live. His veterinarian, right, suggested the dog dewormer, I'm going to butcher this name, fenbendazole, which had shown promise against aggressive cancers. By early 2018, Tippin was cancer-free. So, do what you will with that information. It's certainly something worth looking into, all right? If parasites are really such a widespread issue, an underlying cause of many diseases, why are our diagnostic tests not revealing them? Well, one of the reasons is because they're not doing the test correctly. When you order a test, and even when we order a test, we'll order a test and they'll send a little packet for you to do a stool sample. If that stool sample came from the right part of the colon, it may have parasites. However, most of the time it doesn't. Ms. Gittleman says that the reason parasites are not showing up in the stool test is because we're not digging deep enough. Now, I know that's kind of funny, no pun intended there. Parasites can evade normal stool exams because they tend to reside deep in the colon. It may take several consecutive bowel movements to finally reveal their presence. We're not seeing them in the stool sample, she said, because we're not purging the stool. The concept of cleansing the bowel before testing is not new. It's just forgotten. One of the physicians Ms. Gittleman studied with, and when she was learning about parasites, was a parasitologist from Mesa, Arizona, Dr. Lucrece Dowell, who gained her expertise by working with soldiers overseas in World War II. In some cases, she had to purge the patient's bowels as many as 10 times to finally reveal the parasites lurking within. That's what's missing, Ms. Gittleman said. We're using random stool samples and you're not finding them because you're not going up high enough in the bowel. So, how do we protect ourselves, right? How do we protect ourselves? We do herbal cleansing. Ms. Gittleman advocates herbal cleanses to eliminate parasites twice a year. She cites significant results, including clients who recovered from skin conditions, anxiety, insomnia, arthritis, and autoimmune issues. She often prescribes wormwood, used for centuries in Europe and Asia to treat parasites. Modern research shows that wormwood is effective against parasites. There's another herb called mugwort that also battles parasites effectively. However, it doesn't taste very good. Other parasitic foods include cloves, pumpkin seeds, onions, and garlic. They do taste good, but therapeutic doses often exceed what you would normally eat. So, what does that mean? That means you need to get a parasite formula. We have parasite formula. The three main herbs in them are wormwood, cloves, and mugwort. All right. So we want to make sure that you want to do all three because they target all three different ones. I think the formula we use also has black walnut hulls in it. All right. So we've got the wormwood, the black walnut hulls, and the clove. It takes care of everything. I've taken it for years and years and years, never been sick, Never seen any evidence of parasites, but maybe that's because I do this, frequently, so I never get really infested with it. So you want to do that, or you want to eat a lot of pumpkin seeds, or you want to eat a lot of garlic. You can juice garlic. You can eat garlic raw. I mean, you're gonna stink. However, you're gonna be parasite free. Maybe that's why in the old Dracula movies, right, they put the necklace of garlic around them so that the Dracula wouldn't come and get them. All right. Maybe what we avoid eating can have a larger effect on whether we harbor parasitic infections. To minimize the risk, we urge people to wash their produce and cook their meat. I can't tell you how many clients have become totally well when they get off sushi because they're ingesting worms, worm eggs, and worm typhocyte cysts, all kinds of things when they're eating fish that is uncooked. She said fish is much more wormy than meat. So do with that as you will. I have seen, and you probably have seen, x-rays of a torso that was full of worms from a person that ate a lot of sushi. Now, I don't know if that was photoshopped. I don't know, but I do know that people that eat sushi do have more parasites than people that don't. Not saying don't eat sushi. If you want to eat sushi, eat sushi. However, take your anti-parasitic herbs too, because you don't want to be harboring pests. Not everyone is equally susceptible to parasites. People with strong stomach acid, good digestion, have immunity to the parasites. The strength of a person's stomach acid can be determined by a diagnostic test called the Heidelberg test. It's typically used to evaluate for conditions such as gastroesophageal reflux disease, to which decreased stomach acid may be a contributing factor. Now, most of the time, if you're not studying this, you go to the doctor and you have acid reflux and the doctor says, oh, you've got too much acid. Well, honestly, if they did this test, they would find that you had too little acid. And so if you supplement with hydrochloric acid, betaine hydrochloric acid, betaine HCl, if you supplement with that, you're going to find that you raise the level of stomach acid, and the stomach acid is able to do away with the parasites. It is the first barrier to the parasites. Also, you want to do digestive enzymes as well. Now, Dr. Hulda Clark says that because we've got so much benzene, which is a solvent, we've got so much benzene in the environment that we are breathing it in, we're getting it in, however we're getting it in, but the solvent actually opens up the egg casing of the parasite and allows the parasite to get into the bloodstream instead of passing through the GI tract and out into the potty the way it's supposed to. So she's got tons of books on that, tons of resources on that. So you want to look at that. Our environment does, if like we here in Houston, ship channels just a little bit south of here. And when they have an explosion or when they've got a gas release or whatever, it gets into the atmosphere and we all get it. Whether you want to get it or not, we all get it. And so benzene is something that is used as a solvent, an industrial solvent. I even found out my perfect hairspray was recalled because they used benzene in the hairspray. Who does that? I don't know. Am I glad that it's off the market? Well, yes, because we don't want benzene in our environment. Am I sad that it's off the market? Yes, because I like the way it held my hair and all that kind of stuff. However, we've got to be really, really careful and make good choices because the benzene is a solvent and it allows the parasites to get loose in the bloodstream and not just pass out of the GI tract the way it is supposed to. So I know that's just a lot of information for you. You probably are looking around thinking, am I the 1 in 3 that has parasites? Well, you probably are. If you don't do regular parasite cleanses, you probably are. If you like to munch on ice, you like to crunch on ice all the time, that's a sign of parasitic infection. If your children are picking their nose all the time, that's a sign of parasitic infection. If your bottom itches, especially in the new moon or the full moon, that's a sign of parasite infection. So all of these are symptoms that we may have. Nobody's going, oh, and if you chew your fingernails, that's another sign of parasitic infection. So if any of those apply, you need to go come see us, go to your local health food store, wherever you are, and get some parasite herbs and take them. Now, you want to take them for whatever it says on the bottle, and then you want to additionally take them the week of the full moon for the next 3 months. Why is that? Because of the life cycle of the parasite. It's got your larva, your pupa, your neophyte, your whatever it is, okay? They're all different depending on what you've got. So you want, some herbs are going to catch them at just one cycle. So do the full course for the 30 days, 60 days, whatever it says. Then on the next full moon, and then the next full moon, and then the next full moon that week. And after that, you will have cleared pretty much all of the parasites out of your system. And you need to do that annually. You need to make sure that you're taking care of yourself and doing all the things so you're preventing that as much as is possible. All right? So this is our Lunch and Learn for today. It's the weekend. Like I always say, rest, rejuvenate, recover, do self-care. It's very, very important. We want you to take care of yourself. We want you to be around for next week. Not so sure what we're going to be doing next week. We've got conferences and different things throughout October, so I'll keep you posted on what we're doing, and then I will talk to you soon. You guys take care. Have a lovely, lovely weekend. Thank you for liking, sharing, commenting, all the things, because that just helps us get the word out. And thank you for spending your 30 minutes with me today. Take care.